Good afternoon, everyone. I would like to congratulate Rosier, Villar, and the entire FIS team for putting together this very successful conference. This has been wonderful to discuss innovation in the health industry. We have the chance to now discuss a very relevant topic, even more so based on what we have seen in the past 2 years. We've had to overcome several challenges, but there have been some opportunities as well. We had to reinvent ourselves to manage our organizations. We have 3 important experiences from different industries, and they will be very helpful in understanding this topic. I'll turn over to Andréa Mota first. She'll be describing her experience with the Coca-Cola company. She is one executive there, and she'll be describing what was more important to her and to her company, especially to manage this crisis. Over to you, Andréa. Thank you, Henrique. Thank you. It's a pleasure and an honor to be here. I'm sure I'm going to learn a lot as well. I liked the topic of this panel because, just like Henrique mentioned, we can contribute by providing different perspectives from different industries. So this is the point of view of a large multinational corporation. We were all caught off guard, the largest crisis we've ever experienced. And I would like to start by reminding you that we've been in this pandemic for almost 2 years. At the beginning, it was something in China. We didn't know what was going to happen. Coca-Cola and so many other companies have that characteristic. We operate globally, unlike a government that will look at its own territory, its own country. We look with a kind of borderless approach. We received news from China and we had no information whatsoever. There were so many doubts, but right off the bat, we felt we had to prepare. There was something different about it. This is something that companies can contribute. From the very start, we got in touch with our team in China. They were witnessing it firsthand. We collected a lot of data. We never knew, there was no way of knowing where it was going to lead us. But what happened from that point on is that we defined a strategy. From the get-go, we defined 3 phases. The first one was focused on awareness, trying to help people understand as to the care, the prevention. We lacked information. So the first goal was information. Phase 2, we realized that, well, this is going to take longer than we first thought. So we started supporting communities, especially those that are most vulnerable. And then on to phase 3. So there was some back and forth between phases 2 and 3. After that more acute phase, we realized there was an economic impact. So we decided to help small retailers, an important portion of Coca-Cola. So we were supporting the vaccination effort for those that had already access to that, and also the economic recovery. So these were the 3 phases and how we approached it. As I said, the initial phase was more communication focused. March, April, May of last year, the very beginning. Initially, we were off the air as a company. The brand Coca-Cola is advertising every week, 52 weeks a year. We're dependent upon commercial. So we decided to go off the air. It was a tough decision for such a huge brand like Coca-Cola. So that was so painful. There was so much uncertainty. We couldn't conceive of any positive message to convey. So that was for 54 days, almost 2 months, not airing any commercials. We're not concerned about selling the product. We were trying to find out ways to help. Here are the lessons learned. So we used those resources that we ended up saving from not airing commercials to help people, our logistics people, our intelligence people concentrated on this effort. And here are the top lessons we learned. Number one, actually 5 major lessons and 3 other things that are here to stay. Okay, lesson number 1, active listening. So before you start helping, hand sanitizer, what do you have to do? Let's talk to governments, to ministries of health, health professionals, communities. So we tried to first understand how a company such as Coca-Cola could help. Listen actively before we start doing something, thinking that you know what others need. You have to first listen so that you can more effectively contribute. Lesson number 2, planning. We learned that, and then China, and then Italy, planning was key. And I mean, having an active plan. We heard from our team in China that the pandemic would have cycles. Our initial action was communication focus, prevention focus. We knew we had to go back to that communication because people end up forgetting about these things. So that was an active and flexible plan. We were fearful, doubtful at the beginning, but then we had to focus on health systems and then vaccines. So that was a second important lesson there. The third lesson has to do with what I've just said. Habits. Habits take time. Communications, actions, care, prevention. We knew that it wouldn't require just one action. So we had a couple or a series of actions. So we worked with government agencies, communications or education campaigns. So we had posters in the back of our trucks. So we used the labels of our bottles to convey the message we received from the Ministry of Health. Drawings, we want anyone to understand that message. Habits take time, as I said. So we had to do that a number of times. People are still question or are doubtful about how to prevent themselves, how to prevent from the disease. Lesson number 4 was to use what we already had. I don't have to reinvent the wheel. Oh, I discovered the best way to do that. There are many good people already doing it. So the role of a major organization was to leverage what was already going on. We weren't conceited and believed we would be able to come up with something on our own. So we helped support. We wanted to be helpful. It takes time. And that's the lesson I'm going to refer to now. Think in a network thinking, to think collaboratively, how to join efforts. And I'm talking about the Coca-Cola system. There are 9 groups of bottlers. So we reach many different areas. So we involved partners and other organizations to come up with that network thinking. So these were the 5 major lessons that we learned during the crisis. And I would like to conclude by saying that once we were done with that more critical period, what's left? What remains? I'm still working from home. Coca-Cola is very careful. Where tests will start only in late December. Let me just point out 3 major changes. We're no longer a business-centric company. Of course, the business is important. A company has to be profitable. But we are a people-centric company now. Employees, suppliers, customers, consumers. So that remains. So we are now a people-centric company. The second legacy, if I may, it has to do with a network. As a company today, we have a networked model. We are no longer a company that operates broken down by silos. That's very complex. It involves a lot of pain. You have to review and revise the way you work, the political structure. But after a year almost working in a network, the results are just amazing. So that is here to stay. And finally, as a sustainability director, I'm very pleased because we no longer have a model in which we would look at a specific activities that Coca-Cola could do to help society. Now, we want to make sure that this social impact becomes our business agenda. It's no longer a separate department, something to be in a sustainability report, and that's it. It has to be connected to the business. And we're taking care of that agenda with the same importance, discipline, taking into account metrics, all business or results meetings, because this is our business. If we can't look at the social impact and what company leaves behind to a society, to a country, it cannot be considered a business. So ESG is part and parcel of our business today. So these are the 3 lessons that are here to stay. And I'll get back to you, Henrique. Thank you, Andréa. That was very nice. We can detect many opportunities out there, especially these last 3 lessons that you mentioned. New guidelines, well, they may not be new, but these are guidelines that have to be taken into account today. I'll give the floor now to Mohamed Parrini. He is the executive director of Moinhos de Vento Hospital in Porto Alegre. But he has a very comprehensive background. You have experience in other industries, and I'm sure you resorted to that experience to one of the largest hospitals in our country. Over to you, Mohamed. Thank you, Henrique. It's an honor to be here today. Yes, Moinhos and Mota Day, one of the top hospitals in our country in terms of medical services. I'm very proud to be here with Andréa, Paulo, and with you, sharing my experience. I like the topic that you picked so that we in the health industry with people from other industries. I paid close attention to what Andréa said, and I'm very pleased to know that traditional corporations are beginning to understand the importance. And she, of course, as sustainability director, should be proud because her department is no longer supplementary. It takes center stage now. We're no longer talking about product. I was the director of a hotel chain for Latin America. It's the Marriott now, hotel chain. And we used to say that it's not only a box, a hotel is not only a room, it's an entire experience. How can our customers perceive that experience if our employees do not feel welcome? If they don't realize that what we say, we do what we say. And the pandemic was a great opportunity. But those that are not in the health industry, we've seen that tragedy, this long-lasting tragedy. I was a child, maybe Henrique was younger, but we remember the 80s and the 90s, and we had the HIV pandemic. So we had isolated units to treat patients with HIV. And for those of you that are not in the health industry, so we were very afraid of what could happen, the strength of the virus. I remember people live streaming, country singers, drinking beer, people clapping their hands for professional health professionals. And our folks could not get into the elevator in their own buildings. People did not want to get close to health professionals when things were a little worse, of course. So I was in the United States. I was working for the Johns Hopkins, and then health ministry or health minister Mandetta asked us to help us coordinate that effort. When I joined, or when I came back to Porto Alegre, we had a tent put up, 80 professions to have emergency services. We canceled all elective surgeries. The first community contagion level, we were the first to communicate that it took place in our hospital. So we decided to protect our employees completely. Traditional labs had some shortages. We've invested to come up with our own lab. We realized that it would be too much for them. So we built our own lab. And then we offer our services to the state of Rio Grande do Sul. These are just a few examples. We had the responsibility center, and that's our commitment to society. The results were awful, of course. So financial results were terrible. We came out of it much stronger, actually, along the same lines of what Andréa said. People from other states migrate, come to us because they know how serious we are, how strong we are. And in order to do so, you have to have that strong and resilient culture, because you have to be somewhat prepared. A risk management culture, but a network of employees that are passionate about your company, about your cause. Health professionals are somewhat like that. Some institutions more than others, but that's the case in our organization. This hospital is called Moinhos de Vento because it had to change names. It used to be a German hospital for it served migrants from Germany because those that migrate because of a hunger, war, religious friction, or ethnic conflicts. So these families came to the Rio Grande do Sul. I'm from Rio. 80% of beds used to be in Rio de Janeiro.
So that's why the hospitals had to join hands and set up the institution that we're part of today. We had to change our name as well because in World War II, the Brazilians were threatening to invade because this was where the Nazi were. So we changed our name, we reinvented ourselves, and I think that we have this feeling of belonging to see ourselves represented in a population that is fully Brazilian now. You can tell by my name that I'm not German. I'm from Rio and also from the Arab community. And what connects us is our values, our desire to do good. And I'm very happy to see that we did our job. And I saw that there was a huge amount of companies that sowed a seed of solidarity. For the first time, I saw Brazilians do not have a strong donation culture from a perspective of philanthropy, as the case with the American or European model. We have this rationale of perpetuating wealth from generation to generation, and it's not really in our DNA to see large donations being made by families as we see in other countries. And I saw that during the pandemic, a seed was sowed in several companies expanded these possibilities. I'm not saying that Brazilians are not generous. Actually, we are generous as a people. But for the first time, I saw families and companies and heirs for the first time actively participating in an initiative of solidarity and of helping other people. So I think from the perspective of healthcare, we should have more professionalization and more and better methods. And from the perspective of businesses, we should be more solidary because at the end of the day, products come and go. Except for Coca-Cola, very few products survive the test of time. So products go away, but the brand, the purpose, they stay. And that's the DNA that connects us. Thank you, Mohamed, for your in-depth explanation. We know about the initiatives developed by Moinhos Vento over the course of these last 2 years, and they're very important for the community and for this general context of fighting the pandemic. I'll give the floor to Paulo Mancio, who works in an industry that probably is among the most impacted industries during the pandemic, which is the tourism sector, whether it is for business or leisure. Tourism was highly impacted during the pandemic, and I'm sure that Paulo's experience is really going to give us a very good perspective about that. Because when the going gets rough, the rough get going. Like Mohamed said, it's very important to join hands with other organizations when we are faced with problems such as the one that we are and have been facing during the last year. You have the floor. Thank you, Henrique. It's amazing to be with you. I'm at a loss. I'm at a loss for words because the talks were really brilliant. And by the way, Mohamed will be taking over a hotel next month, which is right across from your hotel, um, from your company, Moinhos Vento. And what will I say about Coca-Cola, a century-old brand? Well, I'm here to share with you a bit of the timeline, as Henrique asked me, and I will take a step back and tell you a bit about of our industry and what happened with the pandemic. 1 year before the pandemic, the hotel industry, the travel industry was one of the very few industries in the world that had been growing by over 10% per month for over 10 years. In the world, it's known as the blessed industry. Accor is a global leader in terms of hospitality and the world, so we're really strong. So that was a very interesting situation for us, and you're going to understand why I'm telling you about the year 2019 with excellent results, several innovations. I could spend 2 hours telling you about what we were doing. So all of that was happening in 2020, and it was pointing towards a brilliant year for us. Came January, and the hospitality and tourism industry is highly connected to the business industry, whereas the leisure trips are a supplement to that. When everything is fine, hotels are doing fine, and hospitals and Coca-Cola, and we can travel for Congress and for leisure. So as a company, we benefit from that. We were doing very well. January was very good. And then came the pandemic. We're really well established in Asia and China. And we started getting relatively accurate information from the get-go. And we thought that, of course, that was a wave that was going to hit Brazil. So we started gearing up for what was coming. And one relevant thing about that year, 2019, was that we're going to distribute dividend bonuses in 2020. And the company that's headquartered in Paris made the first big decision in the first week of March, beginning of April, that we would not be sharing dividends, and we set up a fund. So what we did with that important amount was what we'd been trained to do for the last 5 years. And here I'll pick up on the words of Andréa. We placed people at the center of the company. 5 years ago, Accor placed the human being and the experience of people, as Mohamed said very well. We do not sell one night in a hotel. We sell an experience, a dream, even solitude, by treating our guests well. So for the last 5 or 6 years, it's been a mantra to talk about human beings at Accor. And our collaborators, I've always been treated differently. We have guidelines and procedures, and we have a very nice program. I could spend hours talking about it. It's a program where every collaborator at Accor, we call it the heart is, so or hardest. It's a heart because this ties back to the idea that there is a heart and an artist in each collaborator. So in March, April, and May, 85% of our hotels were closed. And it's just like having grounded airplanes. No one told us to close our doors. It was simply the economy. Very few hotels in the world were closed by force of law. It was simply for economic reasons. But in Brazil, 90% of our hotels also had 0% occupancy, and we were fully ready for an excellent year. But then we had to look at the human beings surrounding us. We had to look and cater to the needs of our employees. So that fund was put at the disposal of any and all core collaborators that needed treatment. So we had very small margins for extremely severe treatments, and we took that responsibility. We did not ask anybody. We made that available. And we have 8 hubs across the world that took on the responsibility of taking care of our collaborators. And that was an extremely valuable message that we sent out. And we found out, and we have very good references in this panel, we found out that not too many people knew about COVID. What we knew for sure was one thing that we noticed right off the bat, that people were scared, and we had to try to mitigate that fear. And we launched a series of actions and initiatives. One of the nicest things that Accor ended up supporting was the global program against violence against women. When everybody went back to living in very small homes, the numbers went skyrocketing in terms of violence against women and also men. So we supported families, people, women, and men who needed that support with the solidarity tariff. And we have several of our hotels which are close to hospitals, and we transformed several of our hotels as places to give support to physicians and to medical teams, to nurses that couldn't go back home because they couldn't have contact with their family members. So they would stay at our hotels, and we would often bring in their families to visit them. And once again, putting the human being at the center of the situation very intensely. So things continue to evolve. And as I told you, there is a series of measures. There is the hardest fund where we looked at our collaborators and we tried to transform our hotels into tools for society. And lastly, I want to mention one last aspect that is also very interesting. When we really didn't know what we were going to do moving forward, back in August or September last year, it was really hazy, the situation about what we were going to do in terms of vaccines and drugs and so forth. We were wondering, well, how can we go back to providing our customers with safety and security? We had to try to mitigate their fears. So we thought, well, we're going to bring an international insurance company into our hotels. And it's Accor, which is one of the biggest health insurance companies in the world. And they came to Brazil. So our guests could stay with us. And if they had any symptoms and if they felt ashamed of calling the front desk and asking for an anti-cough drug, I was the other day I was on an airplane and I was coughing and I had to start looking around me and I was really embarrassed. But anyway, that happened. So if the guests were embarrassed, we would offer them a free medical virtual visit paid for by Accor. And we did something beyond that. We created our protocols. And As we all know, everybody during the pandemic became specialists in sanitation. We created protocols and brought professionals. I created a technical committee of professionals with Brazil's best specialists. Of course, we work with AC at our hotels, and we have to take care of the air circulation. So we wanted to go back to providing our guests with this feeling of safety, but we didn't have a good response. So we thought, well, how are we going to mitigate that? We invited an insurance company, and we asked them to verify that not only were we doing the right things to provide our collaborators and customers with the highest safety standards, but we were also audited by the Bureau Veritas, telling our customers that they could come if they are coming from the north of Brazil or from the south of Brazil or from wherever, they could stay with us because we were taking care of human beings, whether they're customers or collaborators or people who are in need. We wanted to extend a helping hand, and that's fundamental. I think that's the first and most important message. I really saw a very important initiative by many companies, many people, and I think that once again, the take-home message here is that we're leaving the pandemic more humane. Of course, we could talk about several innovations, and we implemented several innovations. We transformed our hotels, but that's not the point. The point is this pandemic has made us even more humane. That was essential for us to leave this pandemic behind. So these were my messages. Thank you, Paulo. And that was also a very relevant message. Thank you for sharing your amazing experience. So now I think we have 20 minutes to look more deeply into some subjects that you touched upon. So to get the conversation going, since we're talking about, we're in a panel with three professionals that represent extremely relevant companies with their very unique experience as administrators. I'd like to hear from you. What are the new skills and competencies, in your opinion, that an executive should develop moving forward to be able to deal with the crisis and everything that stems from it, and to better perform his or her tasks? Is there anything new that you identified or anything that already existed in the past, but that you had to reinforce in terms of your professional activities or of your teams? I'd like to hear you, because there's something that is common across all of your talks, which is placing people at the center of your activities, whether they're partners, collaborators, or customers, or even competitors. We did see some very interesting partnerships between competitors during the crisis. So in your perspective, what should we be looking at and trying to develop as professionals moving forward? Well, I can start. There's lots of different things. The first one is empathy. And empathy is about placing other people at the center of the situation. Empathy has always been important. Another very important thing, especially now, because this pandemic is now way too long already. And I'm talking on behalf of my team and obviously on behalf of others in this conversation. We should be able to tell people or let people know that we're vulnerable. It's okay not to be okay. Everybody has a day when they don't want to turn on their camera. Paulo mentioned violence against women. That is absolutely true, but not only violence, but also overwork. Oftentimes, and that happens to me as well, you have to play double shift. You go to work and you work at the office and you come back home and you do everything that you need to do at home. And it's okay for you to be vulnerable. People have to understand that it's okay for you to feel tired and to take on a more compassionate perspective about burnout and stress. And Henrique mentioned that we've always liked to work with competitors. We do things with Ambev, with Pepsi, and it's really good when direct competitors join hands towards a common agenda. We do that in several different sectors, but during the pandemic, we did a business program with our competitors because we saw that the difficulties that each customer has is the same, regardless of which company we're talking about. So we created this initiative with special conditions and support and help and capacity building to resume our activities. And of course, retailers are competitors. Many of them they went bankrupt. So that was a huge impact.
I agree with Andréa. We lost many people. Maybe the same thing happened at Mota today. Many people quit. Many doctors. Of course, there was exposure. They risked their lives, both doctors and health professionals. And many older doctors quit, simply quit. Many people changed careers. It's cold in here. Many people from the state moved to Santa Catarina. It's not that warm of a place, but there are beaches, and many nurses had to work twice, or they were working 2 shifts, decided to go back to working just 1 shift. Many people were afraid and left the job and quit. Many people lost relatives. So we ended up losing many people. So people are willing to live with less money. I don't know whether we're ready to manage or to do people management just like in the developed world. So in the past, you used to have personal departments or personnel departments, not human resources. So that's a reality in developing nations. You are the employer, period. What if there's a movement coming from the bottom, people wanting to work less? Are we ready to lead these people? How can you be a new leader of people that are willing to contribute, people that are willing to work, to give their time, not just because they need the job? So the pandemic brought our attention to these issues. We have younger generations rethinking these concepts, hybrid formats, working even for a health-related institute, for a health company. I lost 20% of my workforce, very skilled personnel. You can't easily replace them. So that's a tragedy. catastrophic. We have to reinvent ourselves. And even in Latin America, how are we going to attract people that are willing to remain, to stay? But let me remind you, there's no such thing as a company. We have people that represent the company. Who are the directors, the executives that will represent us when we are not looking? This is new. This is the learning lesson. This is the number one, in my opinion. Thank you. Thank you, Mohamed. Very nice comments. Let me reconsider what I was going to say. Let me put it. I'll try to be clear. We're going through major changes, all of us. These are critical times we're going through. And these executives have to be sensitive enough that we're going through some transformations. Those solutions that used to work in the past, so they have to go through some reviewing. The communication with our employees, suppliers, oftentimes we forget about them, just like Mohamed said. We work as an employer, as a boss, period. These guys or these suppliers are human beings. They feel our pain, and there's no guarantee for them. So this is the characteristic that we need from an executive. So they have to find new answers. They have to be very sensitive. We have a very large team. We have over 20,000 employees before the pandemic. There was turnover. Yes. So we have to be sensitive enough, careful enough to understand the new habits of these new employees. Let me share some information. I have a brilliant team in my a person in my team. He lost a relative. He decided to move elsewhere to a small town. I've always saved throughout my life. I've always done the right thing. I suffered, and now I want to enjoy life. What can I tell them? No, don't do this? Of course not. This is just one example. It may seem very simplistic, but it represents the current scenario. Well, two important characteristics for this new leader is sensitiveness and the power to communicate. So we are giving new meaning to those truths that we used to believe 100% in the past, because they're going to be reviewed and revised. Anyway, there's another issue we have to discuss. All organizations suffered from the pandemic, but we're talking about 3 leading organizations in their industries. These 3 leading organizations did their part. How do you manage that balance between doing the right thing and still maintaining business as usual, taking good care of business? How do you keep those two plates up in the air, spinning. When you look at cash flow dwindling, how did you honor your debt, payroll, taxes, suppliers asking for a renegotiation? Government helped to pay salaries, but still, we didn't know how long that would take. So again, how do you balance these two fronts? Would you like to start now, Paulo? Yeah, that's a very complex question indeed. I'll try to be very clear as to the decision we made. I even said that in my initial answer. 2020 was going to be a spectacular year. We had been preparing the company for that wonderful year. We were going to pull it off. And of course, this information is public. First, we asked our board, and then we published it because we are a public company. It's a French corporation with a very strict regulation. So we decided to look at human beings. A very difficult year. Results are public. Our results in 2020 was a negative results, but that was a decision made and approved, and it was a public decision. We looked at human beings. We wanted to take good care of our employees, partners, suppliers. In 2021, we've been working hard and we've been evolving, and the impact of science and I mean the vaccine, the drugs, this is something that we clearly advocate for, and we are very open about it. Results are moderate. And we hope to have a reasonable Q4. I'm being very careful as to the words I choose. 2020 was a very difficult year, negative results. There was a conscious decision. We focused on the human beings. Results were not there, of course. And now, 2021, we're trying to break even, which is no easy feat. 2022, 23 is going to be the uptake. That's what I've been doing. That's it. We have 3 more minutes. I would like to ask you to be very brief, both Andréa and Mohamed. Unfortunately, when the conversation is nice, time flies, right? But over to you guys. Well, let me be straightforward. Coca-Cola has been in business for 136 years. It's not the first pandemic, 2 world wars, several regional conflicts, the Spanish flu, and now this terrible pandemic. We shouldn't look at the year only. Maybe digital companies that their share prices went through the roof, but few companies had good results. We're trying to understand what it's going to look like in 2021, but we should look at the year. We should look at the decade. We should look ahead into the future and take this opportunity to prepare. When you train, because selling Coca-Cola won't be the same after the pandemic. We have digital tools. other types of deliveries. Consumers changed their eating habits. They're more concerned about their health, and that impacts our business. So take this opportunity to learn and to implement important change, knowing that later on you're going to come out of it much stronger, not only as an organization, but as people. That's what I believe in. Mohamed, I would like to thank you for inviting me. It was a great opportunity to learn from all of you. Congratulate FIS. And I would like to say that I agree with my colleagues here today. Losses and crises are directly connected to a long-term strategy. No stock investor, I don't know who the minority shareholder, Warren Buffett, Berkshire, they're not concerned about a short term. Of course, I don't know what the funds are behind Accor. It's a long-term journey. The hospital is celebrating its 95th anniversary, almost 100 years. Mater Dei has a long history, part of the state of Minas Gerais. Again, it's a midterm journey. And as an executive, as a company, we have to keep in mind that shareholders, partners, board members, they're there. They understand that our role is to reinvent ourselves. You have to emerge stronger, reinventing ourselves, be it Moinhos de Vento, Mater Dei, Accor, or Coca-Cola. Not only as companies, but as people, as individuals, and ultimately as a society. And thinking about the country, when we think about Brazil, what is the project for the country? What's our flight plan for 5, 10 years? Where do you want to go? We executives are no superheroes. I hope we don't need superheroes. I hope we have a project for the entire country. We should think about our 5, 10, 20-year long journey. Thank you. Thank you, Osman, and hope we are all successful in the future and our country be successful in the future too. I hope we can have executives that are citizens, looking at their businesses, of course, but looking at the needs of society, the community where they operate, and even generating more value to their own business. That was a very interesting hour, very productive conversation. Thank you, Andréa. Thank you, Mohamed and Paulo. Thank you for your insights. Congratulations to all of you. This concludes our panel. Thank you once again. Thank you.